Hello everyone. Welcome back to Dr. Tristan Anaesthesia Tutorials. I am Dr. Tristan, and we are going to be concluding our series of talks on pediatric neuroanesthesia today. We've got quite a comprehensive tutorial here for you where we're going to talk about common neurosurgical conditions in children and common neurosurgical procedures in children and an anesthetic approach to these. So I hope you guys have been enjoying the series that we've done on cardiacs and now on neuro. We're going to be moving to neonates tomorrow and then carrying on with pediatric anesthesia topics next week. Just to give you guys an update, so on YouTube now, for free, you will have access to roughly the first sort of 30 minutes or so of this talk, and then it will come to an end and you will be directed to Patreon. Please go to patreon.com/Dr. Tristan Anaesthesia Tutorials, and you can pick the subscription option that's relevant for you, where you get anywhere from 8 tutorials a month all the way up to 12 tutorials with show notes, exam assistance, etc., and so much more. So please go look at Patreon and please subscribe so that you can have access to the channel. Just remember that I'm not trying to become a millionaire out of this. It costs me a lot of money to maintain this podcast, to use the various apps, the camera equipment, my time, etc. So I really appreciate your support. And then please like, share, and subscribe everywhere else. And so that's it. And then just remember that this is not medical advice. Please speak to your local doctors if you have any medical questions. And please speak to your local examiners, your local consultants and specialists for any exam-related questions. And follow your local guidelines, please. And then finally, guys, just remember, please give me the credit if you're going to share any of the information from Dr. Tristan Anaesthesia Tutorials. So let's get started, and we will just have a short message from our sponsor, Nova Anesthetic Practice Management.
Welcome to Nova Anesthetic Practice Management, South Africa's trusted partner for anesthetists in private practice. We take the admin off your plate, from billing, patient communication, and digital forms, to scheduling, financial management, and tax planning. You focus on patient care. We'll take care of the rest. Join the growing number of anesthetists who trust Nova to keep their practices running smoothly. Visit novaanesthetics.co.za to find out more.
So today we're going to go through a comprehensive pediatric neuroanesthesia approach. We're going to talk about the challenges, the procedures, and the various outcomes that are relevant to the pediatric neuroanesthetist. And I hope that you guys will find this an important and comprehensive approach. So what are we going to talk about? We're going to talk about the unique challenges in pediatric neuroanesthesia. These are conditions where you are going to be operating on children who are potentially neonates, with congenital abnormalities, children that have had multiple surgeries, children that are small blood volume, limited physiological reserve, who may have significant deficits. They may have significant sensory and emotional challenges. They may have large tumors, etc. So it can be an incredibly challenging, but I find it incredibly rewarding part of my practice. So what we're going to focus on today is we're going to look at common pediatric neurosurgical conditions, typical presentations, and then potential complications. And then we're going to just go through some evidence-based anesthetic management strategies so that we can make sure that we have good outcomes in the pediatric population. And then I think we just need to take a minute to talk about and focus on the need for specialist care and for specialized centers of care. So what I mean by that is that, a lot of big pediatric neurosurgical procedures, cardiac, transplant, etc., these are not things that should be done by part-time pediatric surgeons or part-time pediatric anaesthetists. You need peds intensivists, and you need a really sort of big infrastructure around you when you're doing a major surgery like this. And then I'm going to give you some advice and tips on how to optimize outcomes in pediatric neuroanesthesia. So what are the most sort of common neurosurgical conditions? I think the first one that we're all pretty familiar with is hydrocephalus, which is an accumulation of CSF within the ventricles, and inevitably it leads to a raised intracranial pressure. Now, I'm sure most of you or all of you are aware, that until the sutures of the skull bones fuse and the fontanelles close in a newborn and an infant, which can take up to 9 to sort of 12 months, their heads can get very, very large. And in Africa, in South Africa, in resource limited settings, I've seen images in India, some parts of China, Pakistan, it happens, sub-Saharan Africa, you get massive, massive hydrocephalus with huge, huge heads. And that's because so much fluid accumulates and it stops those sutures from closing. And so the skin just sort of accommodates this very, very large volume. So the most common causes of hydrocephalus are congenital issues with the aqueduct, so congenital aqueduct stenosis, Chiari malformations. And then the most common acquired cause, and probably the most common cause, is an interventricular hemorrhage and meningitis causing hydrocephalus and obstructive hydrocephalus. And those will be by far the sort of most common causes of hydrocephalus that we will see. Now, not all kids need immediate surgical intervention. Some present and need immediate intervention. They present with signs of raised intracranial pressure, of meningism, they may have a reduced level of consciousness, seizures, etc. So initially symptoms sort of start off as irritability, a bit of vomiting, difficulty feeding, and then it will slowly progress to persistent vomiting, to changes in a level of consciousness, to seizures, and then, very severe circumstances, we see what's called sort of sunsetting of the eyes, and nystagmus and all of those sort of things. So as the raised intracranial pressure gets worse, so the symptoms will progress. So what are the treatment options? Well, essentially, we've always kind of done VP shunts. So that stands for a ventriculoperitoneal shunt, whereby the one end of the catheter is placed in the ventricle, it's tunneled under the skin, down the neck, and it's placed into the peritoneal cavity, where there is a one-way valve, a pressure release, a filter, etc., a siphon, and it allows CSF, as the pressure builds up, it triggers the valve to open, and it allows one-way drainage. You do get ventricular atrial shunts, whereby you can place the fluid directly into the atrium. Not that I've ever seen one of those. But now what can be done as a curative procedure is a third ventriculostomy or an endoscopic third ventriculostomy. So what that is a procedure whereby if they have a congenital narrowing of the aqueduct or Chiari malformation, they can then go in and they can actually open up that third ventricle and they can open up that aqueduct and allow for CSF drainage. And remember, the critical thing with hydrocephalus and with the placement of a VP shunt or of an endoscopic third ventriculostomy is that early intervention is key, because without that early intervention, you get loss of brain tissue, you get a buildup of raised intracranial pressure, and you end up having profoundly poor neurological outcomes, unfortunately, for these children. So the next issue that we're going to talk about is brain tumors in children, something that I deal with quite often with the neurosurgeon that I work with. Pediatric brain tumors are the most common solid tumors in children, unfortunately. So it's quite sad, but if a child is going to have a solid organ tumor, it's likely to be in the brain, unfortunately. And these include medulloblastomas, astrocytomas, craniopharyngiomas, ependymomas, um, and based on what type of tumor it is, what type of tissue it is, it will dictate the severity, the prognosis, the aggressiveness of the tumor, whether surgical treatment alone is adequate, whether they will need chemo and radiation, and that will be managed in conjunction with the neurosurgeon, the pediatrician, and the pediatric oncologist. Remember, posterior fossa tumors are an important issue in children, and it's something that we're going to discuss in detail during the tutorial today. And especially medulloblastomas in the posterior fossa, but posterior fossa tumors can account for over half of all pediatric brain tumors. And the resection of these tumors can be incredibly complex. And I will tell the story just briefly of a patient that I anesthetized for posterior fossa surgery, whereby we had to do two 12-hour debulking surgical procedures with two 12-hour anesthetics to try and maintain the cardio stability and the neurostability of the child in order to resect as much of the tumor as we could, because the tumor was not suitable for chemo or radiation. And through a brilliant multidisciplinary team with the hands of a skilled surgeon and with meticulous care to the anesthetic from my part, we achieved great success for that child. And so posterior fossa tumors can be scary, they can be difficult, they can be long procedures, but they can be incredibly, incredibly rewarding. So if we look at other tumors that are important, surgically, these tumors are resected when they have got a significant mass effect, which means that they are displacing normal brain tissue, causing midline shift and raised intracranial pressure. We operate when there is obstructive hydrocephalus, or in rare occasions when there is a need for a biopsy. And depending on the type of tumor, depending on where it is, and depending on whether it's a full resection or a biopsy, it requires meticulous planning and attention to detail to address these underlying issues safely. And, basically, if you look at sort of the anesthetic management issues, we need to consider the relationship between the anesthetic and the intracranial pressure. We need to maintain cerebral blood flow. We need to try and reduce intracranial pressure. We need to keep up with bleeding, and bleeding from brain tumors in children can be swift, rapid, and catastrophic. We need good communication. We need to consider, as we have in scoliosis surgery, that we may be doing neuromonitoring, so that necessitates a total intravenous anesthetic without the use of volatiles or without the use of muscle relaxants. So, there really are very important anesthetic challenges, and a good anesthetic in these cases can really, really make a huge difference in terms of the child's outcome. And if we just focus in specifically for a few seconds on medulloblastoma, and this, as I say, located in the posterior fossa, is a common brain tumor. And we often need to address the need to have a complete resection. As I mentioned to you in the story, sort of brief anecdote that I gave you, you need to get 100% resection, otherwise they just grow back, and you need to address the obstructive hydrocephalus that these tumors often cause. So that's anesthesia for brain tumors, or sort of pediatric brain tumors. As we move along, the next condition that we're going to talk about is epilepsy and craniosynostosis. So in children, there are some surgical options for intractable epilepsy, and this may be things such as a focal resection of an epileptogenic focus. It could be corpus calostomy or vagus nerve stimulation. And for intractable seizures, the use of these surgical procedures can be incredibly helpful and can reduce seizures in up to 60% of patients. To be honest, not something that I've much experience with in children. I'm not aware of how much we're doing of this in South Africa. The episode is not over. There is much more content from Dr. Tristan in the tutorial. Please go to patreon.com and search for Dr. Tristan Anaesthesia tutorials and choose a subscription option that best suits your needs to get access to the full episodes, weekly AMAs, and show notes, and so much more. Thanks so much for your support. Patreon.com/Dr. Tristan Anaesthesia tutorials. Have a wonderful evening.